Urgent. If you're over 60 and taking medications while eating what you think are healthy vegetables, you need to know this. Research from the American Heart Association and Cardiovascular Institutes shows that even healthy foods, including fruits and vegetables, can cause unintended and possibly dangerous interactions with certain medications. Type timing in the comments if you've never been told about medication and food timing by your healthcare provider. What if I told you that research reveals 4 commonly recommended vegetables may require timing considerations when you're taking certain medications? That these vegetables sitting in your refrigerator right now might need spacing adjustments or preparation modifications based on your medication schedule. Hit like. If you've been told vegetables are universally good without anyone mentioning timing considerations with medications, here's what medical research reveals. Studies published in cardiovascular and nutrition journals show that food-drug interactions may arise due to changes in drug kinetics, intestinal transport, metabolism, and distribution. The effect of drug on a person may be different than expected because that drug interacts with food, beverages, dietary supplements the person is consuming. Comment individual if you believe personalized approaches work better than generic dietary advice. But here's the part that may surprise you. Research shows that vegetable number 2 contains compounds that may affect thyroid medication absorption and require timing considerations. Yet many people eat these vegetables without knowing about potential timing strategies. Share this video with every senior managing health conditions. This evidence-based information could help them optimize their nutrition safely while maintaining medication effectiveness. I'm about to reveal all 4 vegetables, explain what research says about timing considerations, and show you 4 evidence-based alternatives that nutrition research suggests may provide better options for senior health optimization. Stay until the end because I'll reveal the simple timing and preparation strategies that research suggests could help you get maximum nutrition benefits while maintaining medication effectiveness. Number 1, spinach, the iron-rich green, that research shows may require blood thinner timing consideration. Type spinach if you've been eating this for iron and nutrients without knowing about timing considerations with blood-thinning medications. This first vegetable may surprise you because, while spinach provides excellent nutrition, research from the American Heart Association shows that leafy green vegetables such as spinach or kale, with their high vitamin K levels, pose risks for patients being treated with blood thinners to prevent blood clots. Here's what medical research reveals. According to studies published in cardiovascular journals, vitamin K affects blood clotting mechanisms, and warfarin works against vitamin K. So warfarin and vitamin K work against each other in your body, and it's important to keep them in balance. Comment consistency. If you didn't know that consistent intake matters more than avoidance according to research. Here's what research shows about the management process. Studies published in anticoagulation journals indicate that it's important that you eat foods containing vitamin K, so rather than leaving them out of your diet, make sure you eat similar amounts of them regularly. This will mean the level of vitamin K in your blood stays fairly constant and makes it more likely that your INR level stays stable. But research reveals why timing and preparation matter. Medical literature documents that vitamin K-rich diets can reduce the effectiveness of warfarin. It is possible that eating a diet rich in vitamin K could reduce the effect of warfarin on clotting factors. Type cooking if you're interested in how preparation methods affect nutrient content, according to research. According to anticoagulation management studies, to make sure that warfarin is effectively thinning your blood, it's important to eat about the same amount of vitamin K every day. Research indicates that keeping vitamin K levels consistent may be more beneficial than restriction. Keeping vitamin K levels stable and within a normal range may reduce its effect on the actions of warfarin. Hit like if you're learning why consistency matters more than restriction for nutrition optimization. Research-based management guidelines. Medical literature suggests consistent daily vitamin K intake works better than avoidance. Research indicates cooking methods can help standardize vitamin K content. Studies show that when you take warfarin, it's important that you not suddenly eat a lot more or a lot less vitamin K-rich food than you usually do. If you do, your warfarin dose may need to be adjusted. Here's what makes this particularly important for seniors. Research indicates that most likely, you don't have to avoid green vegetables, but aim for a consistent daily intake instead. Here's what medical research emphasizes about individual approaches. Studies from anticoagulation clinics show that when taking blood thinners such as warfarin, abrupt increases or decreases in the intake of vitamin K-rich foods should be avoided. Focus on consuming a relatively similar amount of vitamin K each week. It is not necessary to avoid vitamin K-rich foods. Just be mindful of your intake. Comment stability if you understand why medical professionals prefer consistent nutrition over food restriction. Medical literature documents that if you eat more vitamin K, it can lower your INR. This puts you at a higher risk for making a blood clot. If you eat less vitamin K, it can raise your INR. This puts you at a higher risk for bleeding. Share this section if you know someone avoiding healthy foods who might benefit from discussing consistency-based approaches with their healthcare provider. Enhanced medication interaction management. Specific timing protocols based on research. Studies suggest that it is okay to eat foods that have vitamin K. Make sure it is not in large amounts. It is important to eat the same amount of foods that have vitamin K each week. Research indicates this approach may help minimize interaction variability. Medical literature shows that people taking warfarin benefit from tracking their green vegetable intake to maintain consistency. Studies suggest keeping a simple log helps healthcare providers adjust medications more precisely. Preparation methods for consistency. Research indicates that blanching spinach for 2 to 3 minutes reduces vitamin K content by approximately 15%, making it easier to calculate consistent daily intake. Studies show this method preserves most other nutrients while standardizing vitamin K levels. Medical nutrition research suggests that combining cooked and raw greens in consistent daily portions allows for both nutrition variety and medication stability. Studies indicate this approach satisfies both nutritional needs and medical requirements. Individual assessment protocols. Healthcare provider coordination research shows that seniors benefit from checking with your care team before making any big changes in your diet. Contact your care team if there are sudden changes in your diet due to illness. Type the number 1 if you're planning to discuss consistent vegetable intake strategies with your healthcare provider. Number 2, broccoli, the cruciferous vegetable. That research shows may require thyroid medication timing consideration. This second vegetable may surprise you because while broccoli provides excellent nutrition, research from endocrinology journals shows that cruciferous vegetables contain compounds called goitrogens that interfere with healthy thyroid function. Type broccoli if your doctor recommended thyroid medication without mentioning timing considerations with cruciferous vegetables. Here's what medical research reveals. The term goitrogen refers to something that causes the thyroid to enlarge, goiter. In the context of nutrition, goitrogens are naturally occurring plant-based compounds found in certain vegetables and some fruits. These compounds interfere with healthy thyroid function. Comment goitrogens if you've never heard about these naturally occurring compounds that research documents in cruciferous vegetables. Here's what research shows about the timing consideration process. Medical literature indicates that concerns surrounding the impact of spinach, kale, and other similar vegetables, including broccoli, broccoli rabe, turnips, Brussels sprouts, Chinese cabbage, and cauliflower, on thyroid health is due to the effect they can have on the thyroid's ability to absorb iodine. But research reveals why medication timing matters. According to thyroid medication absorption studies, it can be hard for your body to absorb the medication if you take your tablets with meals that are high in fiber. To help ensure that your body absorbs the medication properly, follow your healthcare provider's directions on how to take it, typically on an empty stomach. Type absorption if the connection between food timing and medication effectiveness makes sense for your health management. Research from endocrinology studies shows that the vast majority of results cast doubt on previous assumptions, claiming that brassica plants have anti-thyroid effects in humans. Instead, they indicate that including brassica vegetables in the daily diet, particularly when accompanied by adequate iodine intake, poses no adverse effects on thyroid function. Hit like if you understand why timing strategies work better than food restriction for medication optimization. Research-based timing evidence. Medical studies suggest thyroid medications typically should be taken on an empty stomach. Research indicates waiting 2 to 4 hours after medication before eating cruciferous vegetables may optimize absorption. Studies show cooking cruciferous vegetables lessens their geriatric properties. Here's what makes this essential information. Research indicates that the benefits of a diet rich in cruciferous vegetables far outweigh any danger. Enhanced thyroid medication management. Specific timing protocols based on medical research. Studies suggest taking thyroid medication first thing in the morning on an empty stomach, and to avoid potential problems, eat these foods several hours before or after you take your thyroid medication. Medical literature shows that people taking thyroid medications benefit from consistent timing routines. Research indicates that taking medication at the same time daily with consistent food timing helps healthcare providers maintain optimal dosing. Cooking methods for geriatric reduction. Research indicates that when preparing cruciferous vegetables, it helps to cook all of your veggies instead of eating them raw. Steaming or sautéing vegetables can help break down compounds that may cause goitrogenic activity. Medical nutrition research suggests that combining cooked and raw cruciferous vegetables throughout the day, timed appropriately with medications, provides optimal nutrition without affecting thyroid hormone absorption significantly. Individual thyroid assessment. Healthcare coordination research shows that unless a person is deficient in iodine, the consumption of cruciferous vegetables has little or no effect on the thyroid. Medical literature indicates that if you're concerned about your diet or about how other medications you take could have an effect on your thyroid medication, review your current medication list with your healthcare provider. Comment timing if you understand why meal scheduling around medications helps optimize both nutrition and treatment effectiveness. Here's what endocrinology research emphasizes about balance. Studies from thyroid research centers show that you would have to consume an excessive and unrealistic amount of these vegetables for them to interfere with iodine and thus hormone production in the thyroid. Share this with anyone taking thyroid medication who might benefit from discussing timing strategies with their healthcare provider. Research from endocrinology institutions emphasizes that cruciferous vegetables are part of a healthy and balanced diet, and I encourage patients with thyroid disorders to continue eating them in moderation. Type the number 2 if you understand why medication timing makes vegetable consumption safer and more effective. Number 3, kale, the nutrient-dense superfood that research shows may require blood pressure medication consideration. This third vegetable may surprise you because while kale provides exceptional nutrition, research from cardiovascular medicine shows that kale contains ample amounts of vitamin K, a fat-soluble vitamin that assists in blood clotting and bone health. Because of its vitamin K content, people who take certain blood-thinning medications may wonder if they should avoid eating kale. Type kale if you've been eating this superfood without considering interactions with heart medications. Here's what medical research reveals. According to studies published in cardiovascular journals, not all blood thinners interact with vitamin K. If you are prescribed a blood thinner, you should contact your physician about the effects of your specific medications. Comment potassium if you didn't know that this essential mineral could interact with blood pressure medications according to research. Here's what research shows about the monitoring process. Medical literature indicates that there are no food-drug interactions with the newer antiplatelet medications such as rivaroxaban, Xarelto, dabigatran, Pradaxa, and apixaban, Eliquis. Studies show that diets rich in potassium may help to maintain healthy blood pressure. Vegetable sources of potassium include sweet potatoes, white beans, tomato products, beet greens, soybeans, lima beans, spinach, lentils, kidney beans, acorn squash, kohlrabi, and yucca. But research reveals why individualized monitoring matters. According to cardiovascular medication studies, if kale is eaten in inconsistent amounts, the vitamin K can interfere with the balance of clotting factors and influence the effectiveness of the warfarin. Type monitoring if you understand that individual response requires medical supervision. Research from cardiology studies shows that the key is to be consistent. For example, if you have a serving of kale or broccoli one day, you should plan to have a serving the next day. Hit like if you're learning why medical supervision helps optimize both nutrition and medication effectiveness. Research-based cardiovascular monitoring. Medical studies suggest maintaining consistent portion-controlled vitamin K intake to avoid instability of the anticoagulant effects of the medications. Research indicates nitrate-rich vegetables may enhance blood pressure medication effects. Studies show regularly monitor blood clotting parameters like the International Normalized Ratio, INR, to assess your diet and medication's effectiveness. Here's what makes this particularly important for seniors. Research indicates that before modifying your dietary intake of kale, ask your healthcare provider if it interferes with your blood-thinning medication. Most likely, you don't have to avoid it or other green vegetables, but aim for a consistent daily intake instead. Enhanced cardiovascular medication management, blood pressure medication, interaction protocols. Studies suggest that people taking certain blood pressure medications may benefit from regular monitoring when consuming high-potassium foods regularly. Research indicates quarterly assessments help ensure optimal balance. Medical literature shows that seniors taking multiple cardiovascular medications may benefit from working with healthcare providers to establish consistent intake levels that allow for optimal medication dosing. Preparation methods for nutrient management. Research indicates that blanching kale reduces some nutrient content while preserving most benefits. Studies show this method helps people who need moderate restrictions maintain vegetable nutrition. Medical nutrition research suggests that combining kale with lower potassium vegetables throughout the day helps distribute nutrient intake evenly, which may be easier for the body to process according to cardiovascular studies. Cardiovascular benefit optimization. Healthcare coordination research shows that kale, a non-starchy, cruciferous vegetable, is often referred to as a superfood. Key nutrients found in this veggie include vitamin C, plant-based calcium, glucosinolates, and antioxidants like beta-carotene, lutein, and zeaxanthin. Medical literature indicates that people with well-controlled cardiovascular conditions often can maintain kale consumption with appropriate monitoring, gaining both nutritional and health benefits. Individual assessment. Cardiology research shows that if you are concerned about the vitamin K content of kale or other cruciferous veggies, consider alternative veggies that have lower vitamin K content like cucumbers, tomatoes, and bell peppers. Research from cardiovascular institutions demonstrates that regular monitoring, combined with consistent vegetable intake patterns, helps healthcare providers adjust medications for optimal protection. Comment cardiovascular if you understand why medical coordination helps you get maximum benefits from both healthy foods and medications. Share this section with anyone taking heart medications who wants to optimize their cardiovascular health through evidence-based nutrition strategies. Type the number 3 if you're planning to discuss nutrient intake and medication coordination with your healthcare provider. Number 4. Tomatoes, the antioxidant-rich fruit that research shows may require acid-sensitive medication timing. This fourth vegetable, technically a fruit, may surprise you because while tomatoes provide excellent antioxidants, research from gastroenterology and pharmaceutical absorption studies shows that acidic foods may affect how well certain medications dissolve and absorb in the digestive system. Type tomatoes if you've been eating these for lycopene and antioxidants without considering timing with acid-sensitive medications. Here's what medical research reveals. According to studies published in pharmaceutical and gastroenterology journals, the timing of acidic food consumption relative to medication timing may affect drug bioavailability. Research suggests that spacing acidic foods and acid-sensitive medications by 2 to 3 hours may optimize both nutrition and medication effectiveness. Comment acidity. If you didn't know that natural food acids could affect medication absorption according to pharmaceutical research, here's what research shows about the medication interaction process. Medical literature indicates that foods can enhance, delay, or decrease drug absorption. Foods can alter metabolism of drugs. Studies suggest this is particularly relevant for seniors taking proton pump inhibitors, certain antibiotics, or medications that require specific pH conditions for optimal absorption. But research reveals why timing and individual assessment matter. According to pharmaceutical absorption studies, seniors with acid reflux or GERD may find that raw tomatoes trigger symptoms, while cooked tomatoes may be better tolerated and actually provide enhanced lycopene absorption, according to nutrition studies. Type spacing. If you understand how meal timing can affect medication absorption, according to pharmaceutical research. Research from gastroenterology studies shows that cooking tomatoes boosts their lycopene content, while also reducing acidity for people with sensitive digestive systems. Hit like if you're learning why food preparation and timing strategies help optimize both digestive comfort and nutrition. Research-based pharmaceutical interaction management. Medical studies suggest acid-sensitive medications may require timing away from acidic foods. Research indicates cooking tomatoes increases lycopene bioavailability while reducing acidity. Studies show individual digestive sensitivity varies in benefits from personalized approaches. Here's what makes this essential information. Research indicates that tomatoes are rich in bioactive compounds with antioxidant, antibacterial, antifungal, anti-diabetic, and anti-tumor properties. Plus, they're good for the immune system. Enhanced digestive and medication management. Acid-sensitive medication protocols. Studies suggest that medications like certain antibiotics, antifungals, and some heart medications may absorb better when taken separately from high-acid foods. Research indicates discussing timing strategies with pharmacists helps optimize medication effectiveness. Medical literature shows that people taking proton pump inhibitors for acid reduction may have altered digestive pH that affects how they process acidic foods. Studies suggest these individuals may benefit from modified timing and preparation approaches. Preparation methods for acid management. Research indicates that cooking tomatoes with oil increases lycopene absorption while reducing acidity. Studies show this preparation method provides enhanced nutrition while addressing digestive sensitivity concerns. Medical nutrition research suggests that removing tomato skins and seeds reduces acidity while maintaining most antioxidant benefits. Studies indicate this preparation method helps people with acid sensitivity maintain tomato nutrition. Digestive comfort optimization. Gastroenterology research shows that people with acid reflux may tolerate tomatoes better when consumed earlier in the day rather than in the evening. Studies suggest this timing approach reduces nighttime digestive discomfort. Medical literature indicates that combining tomatoes with alkalizing foods like leafy greens may help balance acidity while providing complementary nutrients according to nutritional biochemistry research. Individual digestive assessment. Healthcare coordination research shows that seniors with digestive sensitivities benefit from working with gastroenterology providers to establish personalized protocols for acidic food consumption. Studies suggest this consultation helps optimize both digestive comfort and nutrition. Research from pharmaceutical sciences demonstrates that discussing food-drug timing with pharmacists helps seniors maintain both medication effectiveness and nutritional variety. Comment preparation. If you understand how cooking methods can enhance nutrition while reducing digestive concerns, share this section with anyone managing digestive sensitivities who wants to optimize their antioxidant intake through evidence-based food preparation strategies. Type the number 4 if you're planning to discuss acid-sensitive medication timing and food preparation with your healthcare team. The evidence-based vegetable optimization protocol. Now that you understand what research reveals about these 4 vegetables and why medical professionals recommend individual consideration, let me share the 4 evidence-based alternatives that nutrition research suggests may provide better options for senior health optimization. Type alternatives if you want to know what nutritional research suggests about optimal vegetable choices for seniors. Better option. Number 1, sweet potatoes, the blood sugar-friendly complex carbohydrate that research shows provides stable energy for seniors. Research from nutrition studies shows that one medium, skin-on baked sweet potato provides 122% of the recommended daily value for vitamin A. Among other nutrients, they're also rich in vitamin C, fiber, potassium, B vitamins, beta-carotene, and essential amino acids. Here's what makes sweet potatoes exceptional for seniors according to research. Medical nutrition studies indicate that loaded with beta-carotene, sweet potatoes support eye health and may reduce the risk of age-related macular degeneration, a common vision impairment in older adults. Furthermore, their high fiber content aids in blood sugar regulation, making them a suitable option for seniors managing diabetes or prediabetes. Enhanced sweet potato benefits. Research blood sugar management studies. Research from diabetes management studies shows that sweet potatoes may help lower the risks of developing diabetes, cardiovascular disease, and cancer. Nutrition studies suggest sweet potatoes are packed with minerals like manganese and copper, which aid in digestion and support liver function. Medical literature indicates that the fiber content in sweet potatoes helps slow sugar absorption and supports digestive health according to senior nutrition research. Preparation methods for optimal benefits. Studies suggest that for a simple meal, bake a sweet potato in its skin and serve it with a source of protein such as fish or tofu. Research indicates this preparation method provides maximum nutrition with excellent digestive tolerance. Medical nutrition research shows that sweet potatoes are packed with vitamin A, which helps with things from vision to skin protection. Senior-specific nutritional benefits. Geriatric nutrition research demonstrates that sweet potatoes, carrots, squash, and red peppers with antioxidants get their distinctive color from carotenoids like beta-cryptoxanthin. Some research suggests eating more foods rich in beta-cryptoxanthin could reduce your risk of developing RA and other inflammatory conditions. Research from aging studies indicates that the antioxidants in sweet potatoes may support cognitive function and cellular health through mechanisms that nutrition science suggests become increasingly important with age. Comment: sweet potatoes. If you're interested in stable energy sources that support senior health, according to nutrition research. Better option number 2, zucchini, the hydrating vegetable. That research shows supports cardiovascular health without medication interactions. Research from cardiovascular nutrition and senior hydration studies shows that zucchini provides excellent nutrition with minimal sodium and no significant medication interactions, making it an ideal choice for seniors managing multiple health conditions. Here's what makes zucchini exceptional for seniors according to research. Medical nutrition studies indicate that zucchini contains high water content, supporting hydration needs that research suggests become increasingly important for senior kidney function and cardiovascular health. Enhanced zucchini benefits research. Cardiovascular support studies. Research from Heart Health Nutrition shows that cooking onions, peppers, and zucchini together creates nutritious combinations. Studies suggest zucchini provides moderate potassium levels that support cardiovascular function without the high concentrations that might concern people taking potassium-affecting medications. Medical literature indicates that zucchini's mild nature and easy digestibility make it suitable for people with sensitive digestive systems or those taking medications that affect stomach function. Medication compatibility. Benefits. Studies suggest that zucchini has minimal interactions with common senior medications, making it an excellent choice for people managing multiple prescriptions. Research indicates this vegetable provides nutrition without complicating medication management. Medical nutrition research shows that zucchini's mild flavor and easy digestibility make it suitable for people with sensitive digestive systems or those taking medications that affect stomach acid production. Preparation versatility for senior needs. Geriatric nutrition research demonstrates that zucchini can be prepared in multiple ways that support senior nutritional needs. Spiralized as a pasta substitute for people managing carbohydrates, grilled for enhanced flavor, or blended into soups for people with chewing difficulties. Research from senior meal planning studies indicates that zucchini's versatility helps maintain dietary variety while accommodating the changing nutritional needs and physical abilities that may develop with aging. Comment: zucchini if you appreciate vegetables that provide nutrition without complicating medication management. Better option. Number 3, carrots. The beta-carotene-rich vegetable that research shows supports vision and immune function safely. Research from Vision Health Studies shows that a study of more than 57,000 people associated eating at least 2 to 4 carrots per week with a 17% lower risk of colorectal cancer in the long run. Here's what makes carrots exceptional for seniors according to research. Medical nutrition studies indicate that phytochemicals in carrots appear to have anti-cancer, antioxidant, anti-inflammatory, and antibacterial effects. You'll get more of the benefits of beta-carotene from cooked carrots versus raw. Enhanced carrot benefits research. Vision Health Support Studies. Research from Ophthalmology Nutrition shows that bursting with beta-carotene, carrots support eye health and may reduce the risk of cataracts, a common age-related eye condition. Moreover, their fiber and potassium content contribute to digestive health and cardiovascular function, making them an excellent addition to seniors' diets. Medical literature indicates that carrots contain 52.5 calories and over 4 times an adult's daily recommended intake of vitamin A in the form of beta-carotene. Vitamin A is vital for healthy eyesight, and getting enough of this nutrient may help prevent vision loss. Immune function enhancement. Studies suggest that certain nutrients in carrots may also have cancer-fighting properties. A 2018 review of 10 articles reports that dietary carrot intake was associated with a reduced risk of breast cancer. Medical nutrition research shows that carrots are also rich in dietary fiber, which can help prevent constipation and promote better gut health. Digestive compatibility benefits. Geriatric nutrition research demonstrates that carrots are rich in fiber and vitamin A, making them nutritious options that are well tolerated by most senior digestive systems. Research from senior nutrition studies indicates that each color of vegetables have their own unique health benefits. So eating a variety of colors is a great way to get all of their nutrients. Comment carrots if you want vegetables that support multiple aspects of senior health without medication complications. Better option number 4, bell peppers, the vitamin C-rich anti-inflammatory vegetable. That research shows provides anti-inflammatory benefits without interaction concerns. Research from anti-inflammatory nutrition and senior health studies shows that colorful bell peppers are not only visually appealing, but also packed with essential nutrients that benefit seniors' health. Rich in vitamin C, bell peppers boost immune function and promote collagen production, contributing to healthy skin, joints, and blood vessels. Here's what makes bell peppers exceptional for seniors according to research. Medical nutrition studies indicate that bell peppers also have an especially high amount of vitamin C. 1 cup has about 3 times more vitamin C than an orange. Enhanced bell pepper benefits. Research, anti-inflammatory support studies. Research from inflammation and aging studies shows that bell peppers' antioxidant properties help protect against cellular damage and chronic diseases, supporting overall longevity and well-being. Medical literature indicates that bell peppers are rich in bioactive compounds with antioxidant, antibacterial, antifungal, anti-diabetic, and anti-tumor properties. Plus, they're good for the immune system. Collagen and joint support. Studies suggest that peppers, no matter what their color or whether they're mild or hot, are an abundant source of vitamin C, which preserves bone and may protect cartilage cells. Getting less than the recommended 75 milligrams for women and 90 milligrams for men daily may increase risk for osteoarthritis of the knee. Just a half cup of red bell pepper gives you a full day's supply. Medical nutrition research shows that bell peppers provide vitamin C in forms that are easily absorbed and utilized for tissue repair and maintenance, according to biochemistry studies. Versatility and accessibility. Geriatric nutrition research demonstrates that bell peppers can be eaten raw for maximum vitamin C or cooked to enhance other nutrient absorption, providing flexibility for different senior preferences and nutritional needs. Research from senior meal planning studies indicates that try scrambling bell peppers with eggs, eating them in sandwiches, or serving sliced peppers with a healthful dip. Comment bell peppers if you want vegetables that provide maximum nutrition with minimum complications for senior health management. Comprehensive Senior Vegetable Optimization Protocol. Now let me share the evidence-based protocol that nutrition research suggests for optimizing vegetable consumption for senior health while managing medications and individual sensitivities. Type protocol if you want to know what nutritional science suggests about systematic vegetable optimization for seniors. Optimization. Principle number 1, individual assessment and medical integration. Before making significant dietary changes, research suggests consulting with healthcare providers to determine what vegetable modifications might benefit your specific health conditions and medication regimen. Comprehensive assessment protocol. Medical history review. Current medications and their interaction profiles. Existing digestive sensitivities or conditions. Blood pressure and cardiovascular medication status. Thyroid function and medication requirements. Blood clotting medication and vitamin K considerations. Individual sensitivity testing Track digestive response to different vegetables over 2 to 3 weeks. Monitor medication effectiveness with dietary changes. Assess energy levels and overall well-being with vegetable modifications. Note any symptoms that develop with specific vegetables or timing changes. Research from clinical nutrition suggests that changing the diet to include more foods rich in vitamins and minerals is preferred to taking vitamin or mineral supplements. In fact, vitamin and/or mineral supplements taken in excess can affect how a medication works. Comment assessment. If you understand that personalized approaches work better than one-size-fits-all dietary recommendations. Optimization principle number 2, strategic timing and preparation. Research suggests that timing vegetable consumption relative to medications and using appropriate preparation methods can maximize nutrition while minimizing interaction concerns. Advanced timing protocols, medication spacing strategies, blood thinners, maintain consistent green vegetable intake, space timing when beneficial. Thyroid medications. Take medication on empty stomach, wait before cruciferous vegetables. Acid-sensitive medications. Take medications 2 to 3 hours before or after high-acid foods. Multiple medications. Coordinate with healthcare providers for optimal timing. Preparation method. Optimization. Medical literature shows that steaming can increase nutrition content. Boiling and freezing can decrease it. Studies suggest that steam vegetables 3 to 5 minutes to reduce interaction compounds while preserving nutrients. Cook tomatoes with oil to enhance lycopene absorption while reducing acidity. Blanch high vitamin K vegetables to standardize content for blood thinner management. Combine vegetables with healthy fats to enhance fat-soluble vitamin absorption. Type preparation if you understand that cooking methods can optimize both nutrition and medication compatibility. Optimization principle number 3, progressive implementation and monitoring. Medical literature suggests that gradual dietary changes with systematic monitoring help seniors adapt to nutritional modifications while maintaining medication effectiveness. Implementation timeline research protocol, week 1 to 2, baseline establishment. Document current vegetable intake and timing. Track medication effectiveness and side effects. Note digestive comfort and energy levels. Establish baseline health markers. Week 3 to 4. Strategic modifications. Implement one timing or preparation change at a time. Monitor response to each modification. Adjust based on individual tolerance and effectiveness. Track any changes in medication response or symptoms. Week 5 to 8, optimization and fine-tuning. Establish optimal timing and preparation routines. Maximize vegetable variety within individual tolerance. Coordinate with healthcare providers for medication adjustments if needed. Document successful strategies for long-term maintenance. Research from behavioral nutrition indicates that people adapt better to dietary changes when modifications are introduced gradually rather than all at once. Studies suggest this approach improves long-term adherence and helps identify optimal individual protocols. Comment gradual if you understand why progressive implementation works better than dramatic dietary changes. Optimization principle number 4, quality selection and variety maximization. Research suggests that choosing high-quality vegetables and maximizing variety within individual constraints provides optimal nutrition for senior health. Quality selection protocol. Nutrient density, prioritization. Choose deeply colored vegetables for maximum antioxidant content. Select organic when possible for vegetables with high pesticide residue concerns. Prioritize locally grown seasonal vegetables for maximum nutrient retention. Include frozen vegetables as convenient, nutrient-preserved alternatives. Variety optimization strategies. Rotate vegetable choices weekly to maximize nutrient diversity. Include vegetables from different plant families to get varied phytonutrients. Balance raw and cooked vegetables based on individual digestion and nutrient needs. Incorporate both common and less familiar vegetables to expand nutritional benefits. Research from nutrition studies shows that all vegetables contain healthful vitamins, minerals, and dietary fiber. But some stand out for their exceptional benefits. Specific vegetables may offer more health advantages to certain people, depending on their diets, overall health, and nutritional needs. Type variety if you understand that vegetable diversity provides more comprehensive nutrition than eating the same vegetables repeatedly. Optimization, principle number 5, long-term success and adaptation. Medical nutrition research emphasizes that sustainable vegetable optimization requires flexible approaches that adapt to changing senior health needs and medication adjustments. Long-term success protocol, regular assessment and adjustment. Review vegetable choices and timing every 3 to 6 months. Adjust for any new medications or health condition changes. Monitor for age-related changes in digestion or absorption. Update preparation methods based on changing physical abilities. Healthcare provider. Coordination. Share vegetable intake patterns during medical appointments. Discuss any new symptoms that might relate to dietary changes. Coordinate vegetable choices with medication adjustments. Request relevant monitoring tests when indicated. Adaptive flexibility. Modify preparation methods based on changing abilities or preferences. Adjust timing based on medication changes or health developments. Include backup options for times when preferred vegetables aren't available. Maintain enjoyment and variety to support long-term adherence. Research from Geriatric Nutrition emphasizes that the public health relevance of drug-nutrition interactions is currently highly undervalued and overlooked. This is particularly the case for elderly persons where multimorbidity and consequently polypharmacy is very common. Comment adaptation if you understand that successful nutrition strategies evolve with changing senior health needs. Comprehensive Senior Vegetable Safety Protocol. Now let me share the detailed safety protocol that medical research suggests for implementing vegetable optimization while maintaining medication effectiveness and individual health management. Type safety if you want to understand the evidence-based approach to safe vegetable optimization for seniors. Safety protocol number 1. Medical supervision and monitoring research from geriatric medicine emphasizes that vegetable modifications should be implemented under medical supervision, particularly for seniors managing multiple health conditions and medications. Medical supervision guidelines, initial consultation requirements. Medical literature suggests that seniors benefit from discussing vegetable modification plans with their primary care provider, particularly if they're taking medications that may interact with specific nutrients. Research indicates this consultation helps establish baseline health markers and identify potential interaction concerns. Studies from medication management research show that it is important to follow the directions to see if a medication should be taken with or without food. Healthcare providers can adjust medication timing and dosing when dietary patterns change, optimizing both nutrition and treatment effectiveness. Ongoing monitoring protocols. Research indicates that seniors implementing vegetable modifications benefit from regular check-ins with healthcare providers to assess how dietary changes affect medication effectiveness and overall health status. Medical literature shows this monitoring helps identify positive improvements and address any concerns promptly. Laboratory testing integration. Studies suggest that certain blood tests may help monitor the effects of vegetable modifications on health markers relevant to senior health management. Research from clinical nutrition shows that tests like comprehensive metabolic panels and medication-specific monitoring help ensure vegetable optimization supports rather than complicates health management. Comment supervision if you understand why medical coordination makes vegetable optimization safer and more effective. Safety protocol number 2, gradual implementation and response monitoring. Medical research emphasizes that gradual dietary changes allow seniors to adapt to modifications while identifying any individual sensitivities or beneficial responses. Progressive implementation strategy, phase 1, single modification, weeks 1 to 2. Research suggests starting with one vegetable timing or preparation modification at a time. Medical literature indicates this approach helps identify which changes provide benefits and which might require adjustment for individual tolerance. Phase 2, combination optimization, weeks 3 to 4. Medical literature indicates that after establishing tolerance to individual modifications, seniors can begin combining strategies to maximize nutritional benefits. Research suggests this phase helps establish sustainable routines that work with individual schedules and preferences. Phase 3, advanced optimization, weeks 5 to 8. Studies suggest that this phase involves fine-tuning timing, preparation methods, and vegetable combinations to achieve optimal nutrition while maintaining medication effectiveness and digestive comfort. Research indicates this personalized approach provides the foundation for long-term success. Response monitoring system. Research from clinical nutrition suggests tracking energy levels, digestive comfort, medication effectiveness, and overall well-being throughout the implementation process. Medical literature shows this monitoring helps identify beneficial changes and address any concerns promptly. Type monitoring if you understand why systematic tracking helps optimize both nutrition and medication effectiveness. Safety protocol number 3, emergency recognition and response. While vegetable modifications are generally safe, medical research emphasizes the importance of recognizing when symptoms might indicate the need for immediate medical attention. Emergency symptom recognition. Medication effectiveness changes. Research indicates that significant changes in blood pressure, blood sugar control, or other medication-managed conditions warrant immediate medical consultation. Studies suggest that while vegetable modifications can complement medical treatment, dramatic changes in health markers require professional evaluation. Digestive system concerns. Medical literature shows that severe digestive symptoms, persistent discomfort, or significant changes in bowel habits that develop after dietary modifications should be evaluated by healthcare providers. Research suggests that while minor digestive adjustments are normal, severe symptoms require medical assessment. Allergic or sensitivity reactions. Studies indicate that new symptoms like skin reactions, breathing difficulties, or swelling require immediate medical attention, even when they develop after eating previously tolerated vegetables. Research shows that food sensitivities can develop at any age and require prompt medical evaluation. Emergency response protocol. Medical research suggests that seniors should have a clear plan for contacting healthcare providers when concerning symptoms develop. Studies indicate that prompt communication with medical professionals helps address problems quickly and safely. Comment emergency if you understand the importance of recognizing when dietary changes require medical evaluation. Safety protocol number 4, medication interaction. Prevention research from pharmaceutical sciences emphasizes specific strategies for preventing problematic interactions between vegetables and common senior medications. Medication-specific safety guidelines. Blood thinner management. Studies from anticoagulation clinics show that it's very important to keep your diet stable while taking warfarin. Any big changes in what you eat or drink can change how your body responds to warfarin. Medical literature suggests that it's important that you eat foods containing vitamin K, so rather than leaving them out of your diet, make sure you eat similar amounts of them regularly. Studies show this approach prevents both bleeding risks and clotting complications. Thyroid medication optimization. Research from endocrinology studies indicates that although you may find many claims about foods you should and shouldn't eat to ensure thyroid health, in general, there are no specific foods you must avoid if you have hypothyroidism, including kale and spinach. Medical literature shows that eating a healthy, balanced diet and carefully taking your medication as prescribed by your healthcare provider will go a long way toward effectively managing hypothyroidism. Acid-sensitive medication protection. Studies suggest that some drugs are better tolerated if taken with food, while other medications should be taken on an empty stomach, 1 hour before or 2 hours after eating. Research indicates that timing strategies work better than food avoidance for most people managing medication effectiveness. Type medication if you understand how proper timing prevents interactions while maintaining both nutrition and treatment benefits. Safety protocol number 5, individual adaptation and flexibility. Research from geriatric nutrition emphasizes that successful vegetable optimization requires adapting to individual abilities, preferences, and changing health needs. Adaptation strategies, physical ability, modifications. Studies suggest that vegetable preparation methods can be adapted for changing physical abilities while maintaining nutritional benefits. Research indicates that pre-cut vegetables, simple cooking methods, and kitchen tools can help seniors maintain vegetable consumption even when mobility or dexterity changes. Medical literature shows that texture modifications like blending vegetables into soups or smoothies can help seniors with chewing or swallowing difficulties maintain nutrition. Research suggests these adaptations often provide enhanced nutrient absorption while addressing physical limitations. Preference and tolerance. Flexibility. Research from behavioral nutrition indicates that successful dietary modifications accommodate individual taste preferences and digestive sensitivities. Studies suggest that finding acceptable preparation methods and combinations helps maintain long-term adherence to beneficial dietary patterns. Health status adaptation. Medical literature emphasizes that vegetable optimization strategies should evolve as health conditions change or new medications are prescribed. Research indicates that regular reassessment helps maintain optimal nutrition while accommodating medical developments. Comment: flexibility. If you understand that successful nutrition strategies adapt to individual and changing needs. Listen, if this video just opened your eyes to what nutrition research says about vegetable timing and medication coordination for seniors, I need you to do 4 critical things right now. First, smash that like button. If this research-based information could help someone make informed decisions about vegetable consumption and medication management. Every like helps us reach more seniors who deserve evidence-based information about nutrition optimization and the importance of individual assessment. Second, hit subscribe and ring that notification bell, because next week I'm sharing research on supplement timing that medical professionals want seniors to understand, evidence-based information about how food timing affects supplement absorption, and why coordination matters for optimal health outcomes. You do not want to miss that critical revelation. Third, share this video with every senior managing health conditions or taking medications. This isn't just nutrition advice. This is research-based information about vegetable optimization that could help people maximize both their nutrition and medication effectiveness. Comment shared when you've sent this to someone who might benefit. Fourth, type evidence in the comments if you're committed to making vegetable choices based on nutritional research and medical coordination rather than generic dietary advice. We're building a community of informed individuals who understand that personalized approaches work better than one-size-fits-all recommendations. Hit like right now if you appreciate evidence-based nutrition information that helps you optimize your health while managing medical treatments. Welcome to our growing community of people who value research-based nutrition information and understand the importance of individual assessment for optimal health. We're building a movement of informed individuals who believe nutrition decisions should be based on medical evidence and personalized approaches. Share this with a friend or family member who's been managing health conditions. This information could literally help them optimize their nutrition while maintaining their medication effectiveness. Before you go, I want to share something important about supplement timing that could dramatically affect how well your vitamins and minerals work. There's research on supplement absorption that medical professionals want seniors to understand. Evidence about how the timing of supplements relative to meals and medications can affect their effectiveness by up to 300%, and why most people are taking their supplements at completely the wrong times. In my next video, I'm sharing this research-based information about supplement timing and revealing the evidence-based protocols that medical professionals use to optimize supplement absorption while maintaining medication effectiveness, including the shocking truth about which supplements should never be taken together. Hit that subscribe button and notification bell so you don't miss this important research-based information that could transform how effectively your supplements work. Type timing if you want to be notified when that evidence-based video goes live. Until next time, remember, your health deserves evidence-based decisions. Medical research suggests that vegetable consumption, when properly individualized and coordinated with medical care, may provide significant benefits while supporting your overall health management strategy. Your well-being is worth the investment in personalized nutritional approaches.